All right, let's stay on this subject and bring in Saleem Oweis, who is the UNICEF Communication Officer for the Middle East and joins us live from Deir al-Balah in central Gaza. Welcome to the programme. Really great to have you on. Just tell us, Saleem, what are you seeing with regards to the polio epidemic across Gaza and how is it affecting children?
Well, until the moment, as you said, there are no clinical cases, but what I'm seeing on the ground is lack of clean water, sewage water all around displacement camps and people's surrounding in general. So what we're seeing on the ground is a high risk of spreading of a disease if it starts. If it starts, that's a really terrible thing. That's why with our colleagues in WHO and UNRWA and other agencies, we're working together to get vaccines in, but moreover to get vaccines distributed and administered to children who are at risk.
And Saleem, we heard the WHO has said that they're sending over 1 million polio vaccines to Gaza, but that challenge, as you mentioned, to distribute it, how will 1 million polio vaccines be distributed in Gaza?
Well, yes, that joint effort by WHO, UNICEF, is really immense. But what we're working on as well is the cold chain and how we're gonna sustain that operation and to get the facilitation and the clearances and the guarantees on the ground that we are able to deliver the vaccines to the children. It's really challenging, and as we've seen in 10 months, aid has been trickling, has been really low in amounts accessing Gaza, but also it's been really difficult to get that aid, the little that we have all around. So if that's the case for the vaccines of polio, that means there's a huge risk of starting to see polio spreading among children, and we really can't afford that. That's a really dangerous thing to see, and as everyone knows, polio has no borders, so it's really a regional issue. It could be if it spreads, but so far, thankfully, we don't have any cases. We hope that with the vaccines that we are hopefully getting inside and hopefully getting distributed, we will not see that. But that's all dependent on the coordination, facilitation, and guarantees on the ground.
And Saleem, as you say, there have been no clinical cases, but just remind us, how dangerous could polio be for children?
Well, as simple as polio is one of the fastest diseases to spread. The ultimate outcome might be paralysis, but also death. And in circumstances like the Gaza situation, the humanitarian situation in Gaza, with overcrowdedness, with lack of the basics of clean water for drinking, but also for cleaning, lack of hygiene supplies, there's some soap, detergent, whatever is used for usual cleaning. As we see now in the Gaza Strip, families are resorting to seawater to clean their clothes, to sand to clean their pots, and just normal water with some. The other day I was in a camp and the mother said, I use lemon with water to clean my children, to bathe my children. So very primitive kind of interventions to clean, and it's not good enough against polio. So polio is really dangerous, and again, we can't afford polio to spread.
Absolutely. Thank you so much for speaking to us here on TRT World. Saleem Oweis, UNICEF Communications Officer, joining us there from Deir al-Balah in Gaza. Do stay safe and good luck with your work.